All right, so I got my first dental implant today. This has been a process. So, but this video is for, I'm going to tell a story on what happened in this video, so you guys have more knowledge than I did going into it, and hopefully you'll be less apprehensive about what's going to happen. So, yeah, so I had a cracked molar, root in a cracked molar. I went to a dentist, and my regular dentist, and said, hey, this hurts, or, you know, so I'm feeling something. It didn't even hurt really. It hurt a little bit. And they said, oh yeah, you cracked a root. Okay, here's what we could do. We give you a bridge, or we can give you a partial, or we can give you or you can get an implant. And I said, well, what would you do? And he said, oh, definitely implant. I'm like, oh, okay. So, all right, great. So I had to go to an oral surgeon to have the tooth removed, which I did. And that was in November, December, somewhere there, November, December, and then they did a great job. And now the recovery from the extraction was not short. I mean, it was like, I guess probably about a week and a half. I was eating on the other side of my mouth and trying to keep that clean. And you know, ironically, you know, dentists are always like brush. Well, you couldn't brush over there for a while because you had to let the gums heal, right? And then there was a big hole, and there was always the danger that hole's going to get infected. So it didn't in my case. I was very fortunate. Everything worked out great. So the extraction was $300. Now, when they do the extraction, you already have your gum like cut into. So they're like, well, if you're going to do an implant, it's recommended that you get a bone graft, right? So at the same time, instead of, I mean, you can wait. At any point in this process, I was told I could wait and decide later. But then they would have had to open the gum up again. So so I said, yeah, sure. Well, that was another $500. Okay. So you can tell this is adding up, right? So then before you can do anything about the implant, they said you have to wait. Now, I guess there's ways to do this if it's an emergency or something. Like, there are ways to do this faster. But this was the process that I did. So you guys tell me if it's different in the comments. But they said you got to wait 3 months before we can do anything else. We want to see if that heals, right? And if the bone graft is actually like becoming part of my jaw, right? I don't know where I got the other bone from. I guess from a human cadaver. I don't know. Something. Oh. Pig. No, I'm just kidding. So I got pig mouth. So I have a pig mouth.
Don't say that.
So oink oink. Sometimes I feel like I do the way I eat. So yeah, okay, so I had to wait. So it was February when I got my follow-up examination, which didn't cost a dime. That was included, right? That was a consult. So so at least that's good. So everything was fine. So they're like, okay, make an appointment, you know, for to do the implant. And I was like, great, you know, let's do it as soon as possible. So I think I made an appointment for the very following week. Oh no, I'm sorry, it was in March. It was in March. So it was the earliest that was convenient was like another month, right? So now we're into 4 months. And then I got my COVID vaccine, right? And I had a symptom, you know, or two the day after. And then the day after that was going to be the implant. And I decided, you know, I know it's 99% chance that what my symptoms were from getting the vaccine, but I didn't want to take the chance and go into a doctor's office and infect somebody else. So I said, look, can we push this back until after my, whatever they call it, full immunity date? I don't know if that's the right term, but whatever, like, you know, the 4 weeks after the shot, because I got the 1 shot. So I made it for the Monday after my 4 weeks was up, which was today. So I go back in and they were zip. So like the extraction took maybe about, I don't know, the whole visit was probably about an hour, but they kind of messed up my paperwork at the beginning. So I'm guessing like 40 minutes would have probably been that. This one, I got to the hospital at 2 o'clock and I was in my car at 3 o'clock. So like that just to give you a time frame. And I walked. I didn't park in the garage. I parked a couple streets away. So the whole visit probably was like a half hour maybe from when I sat down in the chair until I was getting up out of the chair. So that was a lot less time than I thought, because I had a root canal before and that took a long time. I don't ever want to have one of those again. I'd do the implant anytime. Here's the thing though, the implant's expensive. So it cost me $1,900 today.
Oh my God.
Yeah. So you throw that on a credit card, get some points. And then that doesn't even include the crown, which I don't know how much that, I mean, it's not going to cost as much, I don't think, but maybe I'll get a gold crown. That would cost a lot though. So anyway, not going to do that. So, so the process was this. So, I went in, I sat in the chair. They made me fill out some paperwork and rinse my mouth, right, with something for about a minute. And I don't know if that's like, they make me do that when I got my checkup too, which they never used to do at the regular dentist. So I don't know if that's an anti-COVID procedure or if that's just to kill everything in my mouth so that, bacteria, virus, whatever. So I did that, and that was cool. And then I don't know if she was a nurse or if she was like an assistant or an aide, or I don't know. Her name was Jackie. So I was like, so Jackie's like, here. She said, are you allergic to anything? And I said, I don't think so. She said, have you ever had amoxicillin? And I said, yeah, I've had that. I've had that for other dental things over the years. And so she said, okay, well, I'm going to give you some amoxicillin. And it's a preventative antibiotic, basically. So that, I don't, so when they drill into your gums, I guess you don't get an abscess or, So anyway, she gave me a cup with 4 pills in it, 4 capsules, like pretty big ones, like Good and Plenty sized. Like it reminded me of Good and Plenty. They were pink and black, right? And I'm like looking at them, and she's like, "What?" And I'm like, "I don't swallow pills like very well." And she's like, I said, "I don't want to be that patient, but." I'm like, she's like, you don't swallow them at all? I'm like, I very rarely. I usually chew them. And she's like, I'm like, do you have a liquid alternative? And she's like, no, but I'll see what I can do. And I said, no. I said, can I just eat what's inside of them? And can I bust them open and just eat that? And she's like, it probably won't taste very good. And I'm thinking it was like little pellets, like little balls, right? No, it was a powder. Right? So I'm like trying to rip this, and they were tough. So I'm trying to rip the plastic or whatever the coating is. It's not plastic, but whatever that coating is on the capsule off.
She should give you a scissor.
That would have been nice. And then I'm getting powder all over my shirt, and like half of it's on my shirt. And I'm drinking, they give you a little 8-ounce bottle of water, and I'm drinking a little bit of water. But I didn't want to drink too much water, though, because I dehydrated myself before I went to I didn't have anything to drink for at least an hour before I went to the dentist, because I don't want to have to pee when I'm in the chair, right? Because at this point, I don't know how long I'm going to be in the chair. Nobody said anything, except the one receptionist at the previous consult. She was like, it's not that bad. You won't be there that long. And I was like, okay, that's reassuring. So that's why I'm doing this video, to tell you guys, reassure you guys. It's really not that long, and it really wasn't that big a deal. But this is what happened. So I take that. The doctor comes in, I got powder over my... I'm like, I'm sorry, I just don't swallow pills. And I'm like, So anyway, we're doing our thing. A student dentist comes in. So I got 3 people in the room with me now. That's cool. No, that's fine. And it was actually pretty cool, because the dentist and the student dentist were talking to each other. So I was kind of following along like what they were saying while they were doing the procedure. So I kind of had an idea of what the time frame was. So he gave me a topical, and he said he was going to numb me, but not the nerve. Okay, so what he meant was the first time when he took out the the tooth in the first place. He numbed the nerve. So like half of my face went numb. Like I felt like I had Bell's palsy, or you know what I mean, or stroke or something. Like you know, all the way up in my forehead, my eye socket, like everything felt numb. This time, only my cheek and maybe a little bit of the side of my nose, and nothing with my eye and my jaw. And he said the reason we're doing that is because I want you to feel it if I hit anywhere near the nerve, because you don't want this implant to go in and be like impacting the nerve in any way, or you know, when it's placed, right? Because you'd have pain all the time. So I said, well, that's good to know. So he gave me the shot, and he's like, okay, now you're going to feel a pinch, and then you're going to feel burn. I felt none of that. I guess I'm getting good at these shots, you know, but like, yeah, I didn't feel any of that. But he held that needle in there for a little while. So that's something to be prepared for. It wasn't just like zip, zip. It was like in there for a couple seconds before he retracted it. And then, oh, and by the way, I took my glasses off. I can't really see much with my glasses off. But at one point I didn't sign the right paper or something. This was earlier. And I put my glasses on, and they had the tray up there, and I got to see the drill bits. And I'm like, oh, man, I didn't want to see that. So, because they look like drill bits. Like, they look like carpenters, like something I would have used around the house, like DIY stuff. I mean, I don't know what I was expecting. So, but they're decent size, I guess. Because at one point he said something about 3/8, and I'm like, 3/8? So, anyway, so it sounded, you know, from what I could gather, because I couldn't see what was going on, it seemed like they made an incision, and then, you know, and then opened up, and they were looking. Oh, he pressed down. He was testing the area around the gums, make sure it was healthy, make sure there wasn't any abscess, I guess, or anything like that, or infection. So it was good. So then I guess he opened the gum. And they were checking the implant, and I could hear the main dentist saying to the student dentist that see, it's soft, it's spongy, this, that, and the other thing. And I'm thinking that's a bad thing. But then later he's like, you've been doing this in the right way because you didn't wait too long. So I'm guessing if you wait too long, then the bone becomes like hard, right? And then it's harder to drill through. Because when they drilled, and he'd say open real wide, and you were, because he had to put the whole drill in your mouth, right? So it's like decent size, probably about tooth size. So he made so I'm thinking it's going to be like, you know, like when they're drilling like a filling. No, it was like, and then he took it out, and I was like, oh, well, that can't be it. Like, there's no way that's it. And I was right, it wasn't. It was like 3 more. So it was like, and then a little bit, they clean it out, then and then they do another one and clean it out, and that was the 3/8, I guess, was the last one. So what I'm guessing is they drilled a pilot hole and they just made it larger, right? Yeah. And then he said, okay, you're going to feel a lot of pressure. And all the time they're like giving me the suction, you know, like I can spit whenever I want and all that stuff. I mean, you don't actually spit in a sink. You just, they suck up all the stuff in your mouth. So, so then he said, you're going to feel a lot of pressure. And he's like, here, this is going to go in your mouth. And he's going to show me the implant. And I'm like, I don't need to see that. And he's like, oh, well, some people are curious. And I said, okay. So then he got in there, and he's pressing down. And he's saying, like, talking in terms to the other guy about newtons. Like, you see, like, how many newtons this is, you know, blah, blah, blah. So I'm thinking, you know, I know newtons are a unit of force, right? So I'm like, well, why, you know, he's talking about 90 newtons, and no, you don't need 34 newtons, all this stuff. I have no idea what that meant. So I don't think I do. And then he's, you know, like, okay, that's in there. He's like, that's in there really good. So before the procedure, I was talking to the lady Jackie, and she said, there's 2 things that might happen. You might have the screw head might be above the gum line when you're done, or they might put a flap of skin over top of it to conceal it. It depends on how this procedure goes. So it looks like, from what I can see in the mirror, it's just exposed, right? I know you're getting bored. So I'm almost done. So he screwed it in, and yeah, and you can see the screw head and everything. And he even said, he's like, look, that's in there really good. He's like, you could, right now, we could put like a cap on that, and you could go about your merry way. But we're not going to do that. We're going to wait 3 more months until that heals, right? So make an appointment for 3 more months. We're going to come back. We're going to look at it. There may be some skin that forms over top of it, so we'll clean that off. We'll clean it up. And then you'll make an appointment with your dentist to have a permanent cap put on, permanent tooth. So then that'll be the last part of the procedure. But on the whole, this part today wasn't that hard. And he even said, you did the hardest part. The hardest part is the recovery from the extraction. He's like, because you got to keep stuff out of that hole and everything. He said, now, he said, I would eat on the other side of your mouth for a little while, but you can eat right away, you can drink right away, you know, water and everything. And he said, but, you know, he said, but you'll be able to eat on that side of your mouth, like, relatively soon. And as of now, it's like 6.5 hours after the procedure. I'm not really feeling a lot of pain at all. I didn't really have any like bleeding. I had a tiny little bit, like I would spit and it would be pink, but not like red, you know. And they gave me gauze, but I didn't have to wear it. Like when I had the extraction, I had to have that gauze in there for a little while. So I'm done, I think. So anyway, that was it. That was the experience. I hope this helps somebody not to be afraid or to at least know what to expect, because I didn't even know what to expect. So
Thanks, babe.
Yeah.
That was very helpful, I think.
I don't know.
I'm not getting it done.
Yeah. So if you're not getting it done, and you're just here because you are curious, take care of your teeth. Because this is expensive. This is getting real expensive. And then I'll do a follow-up video, I'm sure, after I get the implant or the rest of it. So that's it. Have a great day. Smash the like if you want to help me. Appreciate it. Oh, okay. One more thing. So they had to take an X-ray afterwards, right, to make sure that it was in the right spot. So they're looking at the X-ray after they take it, and it's behind me, and I'm like, "Can I look at it?" And they're like, "Yeah, sure." So I turn around and look at it, and I'm like the Terminator now. So I was like that patient, you know. And then when I'm telling my mother afterwards, because she wants to know everything, I'm telling her the Terminator part, and a commercial for the Terminator comes on her TV set for the movie channel she watches. I know, right? How crazy is that? So anyway, I had fun with it. They probably think I'm a kook, but whatever. So that's
I'm sure
it.
they've had worse.
Yeah, at least I didn't pass out or something. You know, so.